Women and men, boys and girls, should have equal opportunities to achieve their full potential to lead healthy and productive lives. However, throughout the world, women and men, boys and girls, face different challenges and barriers that affect access to quality healthcare, social and education services. Those barriers can be social, cultural, political, and also economic. The USAID Assist project focuses on improving health and social outcomes in USAID assisted countries by strengthening health and social systems and advancing the frontier of the improvement science. So no matter the country or the context, implementation of improvement interventions in health or social services without consideration of gender dynamics risks failure to reach half of the population and may unintentionally exploit or harm one gender. From an implementation perspective, this is an inefficient use of resources, and from an improvement standpoint, this jeopardizes client-centeredness, safety, and equity. So, in order for us to truly improve quality of care for all patients, the different needs of women and men, boys and girls must be explicitly recognized and addressed by providers, by facilities, and also systems. In Assist, we use a holistic and strategic approach to enable those we work with to integrate gender into improvement work. Our gender approach focuses on building local capacity to integrate gender considerations into the improvement work, not having it as a separate and add-on activity. So what is the best way to integrate gender effectively into an improvement program? First, of course, we will have to understand what are the gender issues affecting any context or any program. So we first conduct a gender analysis. By that I mean we collect data that will tell us how are the gender issues that affect women and men differently, affect men and boys and girls differently. Those issues can be cultural, as I mentioned earlier, cultural, social, political, and economic issues. Second, after we understand what the gender dynamics are in that particular context, we then start collecting data and we disaggregate data by sex. The reason we do this is we want to understand how outcomes are being monitored among women and among men, among boys and among girls differently. Once we look at the data disaggregated by sex, we look at what are the issues that affect gaps in outcomes and the different outcomes among boys and girls, among women and men. We identify those gaps and then we design activities to address those particular gaps specifically in that context in a given country. The context can be different in different countries and also in different regions within the same country. Once those activities are identified, and those activities should also take into consideration the gender analysis that we had done at the beginning of the program, those activities will be implemented by our project teams, by the implementing partners in the given country, and then we start monitoring the outcome of those activities. Monitoring outcome is very important because we want to make sure that the activities we design will yield positive results. If they do not yield positive results, we need to adjust the activities as we move along with the project implementation. Sometimes those activities might yield unintended negative results. Therefore, the monitoring of the implementation is critical and important. The last step would be is to document those results and share learning with other project implementers. In this particular example in front of you on the screen, we see that this graph demonstrates improvements in outcomes among HIV, TB co-infected patients retained in care. So the team was able to improve retention in care from 49% to almost 90% among all clients, among women and men. How did they achieve this outcome? First, they disaggregated data by sex, and this is so important because as you can see in the second graph, there is a difference between men and women who were retained in care. And you see that the number of men retained in care was much lower than the number of women retained in care, and the gap was really large. This meant that the team needed to design activities to specifically address gender issues affecting retention among men, and also specific activities to help retention in care among women. What did the team do? In the case of Uganda, the team worked with men to synchronize appointments for TB and HIV care. They also designed activities to remind men, to send them reminders. They designed activities to reach men in the workplace, and to also mobilize community activists to encourage men to come to care. By doing specific activities that address issues that affect men's retention in care, the team was able to close gaps between men and women, and we see that those gaps were closed, and both men and women now have much better outcomes.
Good enough, immediately after the training we had in gender, we also at that time trying to harmonize the quality improvement training materials for the health sector, because previously there were many implementing partners in the country who were conducting quality improvement trainings using different materials. So at that point we were trying to harmonize the materials so that we have a uniform agenda and uniform training materials. So I discussed this with colleagues at the Quality Assurance Department, and we had to include a session on integrating gender in quality improvement, and we also adopted the materials that were used during the URC project. And so all the implementing partners who are conducting quality improvement trainings now are using that agenda and the training materials, and we have also trained more quality improvement trainer of trainers at the national level. This were picked from the Ministry of Health at the headquarters and from the regional referral hospitals, about 27 of them. And so the implementing partners who want to conduct any quality improvement trainings are using this pool of trainers to cascade the trainings at the regional level, district level, and at the health facility level.
As I mentioned earlier, the USAID Assist project focuses on improving outcomes for women and men, boys and girls. Our gender integration approach is fully immersed and integrated in all activities related to improvement on Assist project. We are really proud of the groundbreaking, innovative approach that we designed for Assist, and YHER is working very closely with the teams to help them achieve improved outcomes for men, women, boys and girls. We need to always think about integrating gender across the board in all project activities, starting from the design to the implementation, documentation and learning. By this, we will ensure that we will achieve improved outcomes for all.